Hello, everyone. What I thought I'll do is I had discussed calculating fluid requirement in Mr. Slip's case study, which is related to malnutrition. And I thought it would be good for me to record a video regarding the fluid requirements, which will hopefully make it a little bit more easier for you to understand. Um, sorry. So the first question is, when do you calculate a patient's fluid requirement? So I've just cited some examples over here. These are not the only conditions when you calculate a patient's fluid requirement, but this is something which you have been exposed to and you will be potentially exposed to in MNT2. So yes, some examples of when you would calculate a patient's fluid requirement is number one, which a condition that you have already been exposed to, which is when you suspect that a patient is dehydrated. The patient is, you think that the patient is not having sufficient amount of water. Why would you suspect the patient is dehydrated? It could be probably the biochemistry. The blood indicators are showing, say the patient is having high amount of sodium, or maybe there are certain medications which is increasing your suspicion that the patient could be dehydrated. For example, the patient is on a diuretic like furosemide, and maybe the dietary recall chart or the food record chart which is there, it shows that the patient is not really consuming a lot of water. So maybe there are, so you have a suspicion about the patient's hydration status, in summary, from their biochemistry meaning their blood works like sodium, potassium, electrolytes, which are your water soluble electrolytes, then from the medication, and then from the food record chart. So these are the three things that you were exposed to in Mr. Slip's case study, which was a suspicion that a patient could be dehydrated. So that is one of the nutrients that you would be interested in calculating and investigating further. This would be, say, written, for example, in your section in your data collection sheet, which says that which other nutrients are important for this case. You would say fluid, because of these three specific reasons why you think fluid is of importance to be calculated. All right, so this is an example which you have studied, you have experienced in your MNT1, where you are gradually being exposed to, say, clinical conditions and clinical diseases. Now, when you go further on in your MNT2, you will be exposed to more complex conditions. And this is something which I just briefly highlighted to you when I was talking about, say, fluid requirements in week 2, when we were talking about Mr. Slip's case study. And that time I just said that there are other conditions in which you would put a patient, you would be very careful about the fluid intake of a patient. This is when the patient is on fluid restriction. How would you know the patient is on fluid restriction? This would be very clearly articulated in the medical chart by the physician. For example, the physician may say that the patient should be drinking no more than 800 ml of fluid. And this would be from, say, food plus fluid. So you have to be very careful about what the person is eating and drinking. So this is more of a complex, say, condition. And when would you have fluid restriction cases? This would be in cases where the renal function is compromised. So the fluid output, how do you throw fluid from your body, which is via urine? When the urinary output is compromised, when the kidneys are not working well, the patient may not be passing sufficient amount of urine, and that is when you would be, say, the patient may be on fluid restriction, and the doctor may advise you of the same. So do not just assume a patient is on fluid restriction. It has to be clearly articulated for you to start considering how would you manage restricting a patient's fluid intake, because their output is very less. So in a healthy individual, you have your fluid intake, which is equal to your fluid output, which is predominantly via urine. Okay, so your intake is equal to your output in a general healthy, say, individual. But when it comes to diseases such as renal condition, say heart failure, these are the places where the patient may be on fluid restriction when the patient already has water retention in the body, ascites, say, which you will be learning more about in liver conditions. That is when the patient could be on fluid restriction, but not every kidney patient, not every heart patient, and not every liver patient is on fluid restriction, is what I'm trying to tell you. So this all is more complex learning, and this will only make more sense as you go further in the trimesters. Okay, so right now, example 1 is what you have been exposed to. It is sweet and simple. It has 3 key points to consider, which I had summarized. So keep your understanding till that and apply this knowledge to your exams and your assignments, etc. But you will be taught about this before you are expected to apply it in your assessment settings and things. Okay. Now, which calculations do you use to compute a fluid requirement? Now, again, I am referring to your learning at this stage, which is relevant to MNT 1. All right. So, the calculations which I prefer using is I go to the NEMO resource, which all of you have. And when I have the patients, when I'm using the patient's actual body weight or their usual body weight, one and the same thing. Okay. So, what is their weight currently? So when I'm using that, then I use the NEMO resource which says 30 to 35 ml per kg. So let's assume a patient is say 50 kgs, and then you simply just multiply 15 to 30 and 15 to 35. So the patient should be having 1,500 to 1,700 ml, all right, per day. Okay. Again, this is just a little FYI, which I wanted to share with you. Again, this is higher level learning. It is more complex. And again, this is an MNT2 topic. So yes, you will not be just thrown into a case study where you will be like, okay, now you should know what is drain losses and things like that. No, but I just want to again just informally highlight is when you have your NEMO resource and it says 30 to 35 ml per kg with allowances for extra losses via drain, etc. So what exactly does this mean? Okay. So what does this mean is, again, disclaimer, higher level learning, more of an MNT2 concept covered in your future trimesters. So yes, what does this mean? So just let me take an example of drains. So for instance, when you have, say, surgical patients, not all surgical patients, okay, again, mind you, depends upon the type of surgery, but you have certain surgeries which may require draining of the surgical site. Okay. Why do you have to drain certain surgical sites? Is because you want to prevent the accumulation of pus in that site and fluid retention in that site and say blood in that site. That's why you have to continuously drain that surgical site. So for instance, this is just a rough example over here that you may have say 60 ml of pus and fluid which is drained. So this draining is done by the doctors, by the physician, but they will write in their medical notes that we have drained, or I have drained 60 ml of pus plus fluid from the patient's say liver, because the liver was infected. There was a liver cyst and the cyst was infected and the cyst was accumulating infected, meaning it had pus. All right. And it was accumulating this pus and fluid and 60 ml of this was drained. Okay. So you have to account for that 60 ml over and above this is what it means. Okay. So it is say 30 to 35 ml per kg plus whatever drainages have been happening. Okay. So this is an example of what it means. For example, extra losses via the body. Okay. Extra fluid losses via the body. Okay. So again, this is a complex level learning, higher level learning, not covered in MNT1 at this stage. You will be exposed to this more systematically in the future trimesters. But I hope this makes sense. Now, again, very simple related to MNT1 at this stage of your learning. When you are having a patient's adjusted body weight, all right. So I had, if you remember, I taught you how to calculate ideal body weight and then you implement that formula into adjusted body weight. That is what I'm referring to. So now when using adjusted body weight, These are the fluid requirements you need to be mindful about. So if you see, the fluid requirements in NEMO are based upon the patient's weight status. Okay, so it is if the patient is between 40 to 60 kgs, the adjusted body weight, this is the fluid requirements, so on and so forth. Okay. Similarly, over here, it is 30 to 35 ml per kg. So again, this is based upon the patient's body weight. So irrespective of, say, irrespective of these methods, if you have to use the usual body weight or the adjusted body weight, as you can see, NEMO resource of fluid requirement is based upon the patient's body weight. Okay. And when they say fluid per day, they only mean fluid only intake. It is not fluid plus beverage. Okay. So now at the end, what is my take home message? My take home message is that I use the NEMO resource in, say, when you have simplified MNT1 cases like yourself. I use the NEMO resource in calculating the patient's fluid requirement. Why? Because it is based upon the patient's weight status, and weight status of a patient is a much more stronger indicator of calculating their fluid requirement in comparison to using the generic NRV guidelines which you have, okay, on fluid requirement, which are because NRV guidelines are intended and they are designed for the general healthy population. Okay, so yes, so there are two ways of calculating fluid only requirement. One is using the NEMO resource, considering the patient's weight status, which is more accurate in comparison to the second method, which is the generic NRV guidelines and the requirements. Okay, so for instance, in your handbook, or on page whatever it may be, I think it's 33, but please check again. You have a table in your handbook, table 2.7, okay, I believe, and which gives you two columns, which is food plus fluid liters per day, and then fluid only liters per day. So when you are comparing both resources, NEMO versus NRV, what we have to compare apples with apples. Okay, so the fluid only per liter day column in your handbook is similar to using these things, which is fluid only according to the patient's weight status, be it adjusted body weight status or be it the actual body weight status. Okay, so this is when you're rightfully comparing apples with apples. Okay, so it is a fluid only per liter day column. Okay, so yes, if you use this NRV resource from the handbook, it is not incorrect. Okay, but as I said in Mr. Slip's case study also, is that using this patient's weight for calculating the fluid requirement as per NEMO, this is a much more sound resource and accurate resource in comparison to the NRV. Okay, and it also provides you with a range 30 to 35 ml per kg, and even the adjusted body weight, majority of them, means, see, all of them have a range over here. So yes, you have a range, so meaning you have a bit more allowance to work with. Okay, so yes, my take home message would be, if possible, please, for more accuracy, try using the NEMO resource, which is based upon the patient's weight status, usual or adjusted. Okay, so, and what you are truly calculating is the fluid only requirement. Okay, there could be, say, some amount coming, say, from foods, but as you know, it is not considerably that big of an amount. Okay, so what else? Yes, and please remember, fluid calculations will get, they are more complex in nature when the disease condition becomes more complex. But what you have been exposed to at this level is the first baby step in clinical nutrition, which is what I exposed to you in Mr. Slip's case study. So when you therefore look at Mr. Slip's case study, which I had covered with you, I showed you both of the calculations, the NEMO calculations and the handbook calculation. And the NEMO calculation gave you a range. And when you do the fluid only calculation from the handbook, you see 2,600 sits between 2,500 and 2,900. So I hope this helps you to jog your memory that we did cover this. And yes, at the end, if you see, I went with the NEMO resource, all right? And that is what my take-home message is, that if possible, please use the NEMO resource for accuracy. and you are exposed to this level of learning at this stage, but in your trimester 2, you will be exposed to this level of learning as well. So yes, guys, I hope this was helpful in answering your question, and thank you so much, and I'll see you in the next one. See you.